And I'm thrilled to announce our next speaker, who is Senator Orrin from Utah. And Senator Hatch is the President Pro Tem of the Senate, the longest serving member of the Senate. And in his illustrious career, he has held leadership posts on the Senate Judiciary Committee, the Senate Help Committee, and currently serves as the chairman of the Senate Finance Committee. No senator has contributed more to promoting biopharmaceutical innovation in America than Senator Hatch. From his work bringing the Hatch-Waxman Act to life, to his work in creating a pathway for biosimilars at FDA, he has played a leadership role in nearly every major healthcare bill enacted over the past few decades. It is not an exaggeration to suggest that absent Senator Hatch's leadership in developing the original Orphan Drug Act in 1983 with then Congressman Henry Waxman, patients with rare diseases would not have access to so many treatments or be hoping for treatments that are in development for tomorrow. Senator Hatch?
Well, I'm really pleased to be with all of you here today, and you're doing the right thing. I'm also pleased that Senator Klobuchar is going to speak to you as well. She's a wonderful person. We work together. We've worked together on a number of issues that have been very, very important. And this is one of the most important as far as I'm concerned. Now, throughout my service in the Senate, I've long championed efforts to incentivize the development of new therapies, for those with rare diseases especially. The success of many of these efforts, such as the surge in innovation that has come as a result of the Orphan Drug Act. I remember when we did that back in 1980, the early 80s. Ted Kennedy had been chairman of the Judiciary Committee, and when I became chairman of the Labor and Human Resources Committee, now the Health, Education, Labor, and Pensions Committee, he switched positions to be my ranking member so he could watch over me. He was so concerned. But we found that we could work together, and we did a lot of things together. I have to say the surge in innovation has come as a result of the Orphan Drug Act is really cause for celebration. Prior to the passage of the Orphan Drug Act, few medicines were approved to treat rare conditions. I think there were 3 at the time. For example, just 3 such drugs were approved in 1984. 30 years later, in 2014, 49 orphan products were approved. This progress means so much to families who need these treatments to improve or even save the life of a loved one. And by the way, because of the Orphan Drug Act and the ability to do some of these therapies for population groups of less than 200,000, some of those have proven to be blockbuster drugs that were extrapolated out to really do even more good. Of course, we still have more to do. Nearly 30 million Americans suffer from some form of rare disease. Millions of men, women, and children who have endured tremendous pain, yet still have limited access to care they need. Consider that of the approximately 7,000 rare diseases that exist today, treatments have been approved for only 5% of them. We need to continue strong in our efforts to help those suffering from rare diseases. And that's why I'm pleased to join with my friend Senator Amy Klobuchar and Representatives Joe Crowley and Leonard Lance in serving as co-chairs of the now bicameral Rare Disease Congressional Caucus. I'm proud to work with them in bringing public and congressional awareness to the unique needs of the rare disease community. We now have the opportunity to work with patients, physicians, scientists, and innovators to discuss the development of crucial treatments and address roadblocks to access. We will continue to work together to author and promote legislation to harness the potential of cutting-edge advances in precision medicine and to create incentives for greater innovation in this space. For example, Senator Klobuchar and I are sponsors of the Open Act. This bill encourages pharmaceutical companies to repurpose existing drugs to treat rare diseases by providing an additional 6 months more of market exclusivity for drugs that are approved by the FDA for a new indication for a rare disease. I'm pleased that this legislation was also included as part of the 21st Century Cures Act. Another bill that is advancing through the Senate is the Advancing Targeted Therapies for Rare Diseases Act. Excuse me. This legislation would clear the path for new rare disease treatments by allowing drug sponsors to rely on past drug data when seeking FDA approval of new drugs to treat other genetic subpopulations with the rare disease, or with the same disease. I might add that that's a major breakthrough, because we don't have to go through that huge multi-year process when we already have done all that work. Now, I'm encouraged by the opportunities in front of us and the unwavering support of those of you who are concerned about rare diseases and the rare disease community. Together, we can find new treatments to help those we love. I just want you to know that as long as I'm in the Senate, I'm going to do everything I can to help. We've got to achieve more distinction here. We've got to find more therapies for people who are in trouble, who are in pain, who are suffering from rare diseases that we have no answers for right now. We've made some strides. We've made some headway. But we're going to do better. And it's because of people like you. So I really, really want you all to know how much I appreciate you being here today. I appreciate you meeting with your senators and your congresspeople to encourage them along these lines. There's no reason for anybody not to be with us on these issues, or should I say better, not to be with you on these issues. You're right. You're important. You make the difference. God bless you all. Thanks so much.